To create an effective school CPR AED program, first identify members of your cardiac emergency response team. Team members could include athletic directors, nurses, coaches, maintenance staff, teachers, students, parents, administrators, and other interested individuals who will be fully trained to perform CPR and use the AED. It's important to include team members who are available to support after hours and at off-site events. The entire school staff should receive Project Adam awareness training that includes an introduction to their particular AED, identification of the cardiac response team members, and an outline of how the response should go. Just as sports teams prepare for the big game, cardiac emergency response teams must practice to ensure an automatic and efficient response to an emergency. A cardiac emergency response plan should be part of your school's comprehensive emergency response plan. Be sure that each team member is familiar with the location and content of this plan. Using a mannequin and a predetermined reality-based drill scenario allows the team to go through each step of the emergency response, just as they would in a real emergency. Conducting cardiac emergency response drills is similar to running fire drills. Project Adam recommends drills are conducted at least twice throughout the school year. They should be performed during the school day and during after-school events at times that are unexpected to test the response plan. School administration should be notified prior to planned drills to avoid unintentional calls to EMS. When conducting a drill, it's important to carefully rehearse each step of the response just as if it were a real emergency. First, assess the scene to be sure the scene is safe. Next, check for responsiveness by tapping on the victim's shoulder and asking, "Are you okay?" If the victim doesn't respond, get help. Activate your school's cardiac emergency response. Call 911, start CPR, and get the AED immediately.
I don't really want to be honest, but you want something from the vending machine?
Are you okay?
Davion, are you okay? Wake up! Get up!
You call 911 and I'll get the AED.
You may see some involuntary muscle movement, seizure-like activity, or gasping. Do not mistake this for a response. Consult your school's cardiac emergency response plan to confirm the proper procedure for connecting to EMS. Call 911 as soon as you suspect a sudden cardiac arrest. Provide the school address and the patient location. Remain on the phone with 911. Bring your mobile phone to your patient's side if possible. It's important to make this clear within your school's plan and plan to send someone to wait for EMS to arrive, as many schools are difficult to navigate. Your school cardiac emergency response plan should also include specific agreed-upon wording for public address announcements used in activating the response team. Team members not involved in victim care should manage crowd control, removing students and others from the scene and keeping all non-rescuers out of the hallways. When the AED arrives, CPR continues and the AED rescuer opens the AED and attaches the pads to the victim's bare chest. Then follow the AED voice prompts.
Preparing to shock. Everyone clear. Press flashing button. Shock delivered.
Storing an AED in a highly visible, easy accessible, and central location rather than behind a closed door can mean the difference between life and death. Once help is on the way, it's important to continue CPR with the AED connected until EMS arrives. All events requiring CPR and/or the use of an AED should be reported to your nearest Project Adam coordinator. Remember, minutes matter in responding to a cardiac arrest. Therefore, during drills, it's important to keep track of your response times and look for ways of minimizing them with each successive practice. Responding to an emergency, whether in practice or reality, can be both physically and emotionally exhausting. No matter the outcome, it is important that response teams take the time needed to debrief and discuss what has occurred and seek any additional resources necessary for coping with the situation. With a well-trained team and regular drills, you will be ready for an emergency.